Welcome to Talkin Maine with the Bowtie Boy. I'm Tom Saviello, and I have my good friend, Trampas Hutches. How are you? How are you? Good to have you back.
Good to be
You
back.
are the president of what, the Glee Club?
Yeah, something like that.
Of Franklin Memorial Hospital.
Yes.
And you've been on the show before.
I have been on this show.
So thank you for coming again. I mean, we've tried to bring some of your different people on the show here for the last couple months, which has been kind of cool. You had the psychiatrist who came in and tried to analyze me, and she gave up. You had the surgeon that came in and said I had all my body parts, and I told him I wanted to keep them, so I wasn't ready for new knees or hips or anything like that. But appreciate it. Thanks for coming on.
Thanks for being here. I really appreciate it.
So, Trampas, tell us what's happening with COVID right now. I think that's what probably is foremost on the mind. Then we'll talk a little bit about the nursing program and then some of the strategic plans future for the hospital.
So COVID, as we know, has been here for 2 years. I can't believe it's almost been 2 years since we've been in I think right when it started, my first time on the show here, and we were just talking about that. You know, we really didn't know what it meant and where things were going, but you know, we have a lot more better understanding of it now and how we treat it, and a lot of tools to combat, you know, even getting COVID with the vaccination and all of those things. Right now, I think is that we're at a pivotal time in the healthcare system in the state of Maine. We're experiencing a surge that, quite frankly, we thought we would see early on at the very beginning, but we didn't. You know, we shut down and we really didn't see much of a surge, but now we're experiencing a surge that we've never seen before in COVID patients. And what we're seeing mostly is it's not really the urban areas that's experiencing the surge, it's the outlying rural areas that are experiencing this, and most of it's due to the unvaccinated patients, unfortunately. And so right now, early on in the pandemic, we were sending all of our patients down to Maine Medical Center where we knew they had the ability to care for them. It was a new pandemic and a new disease at the time, so we really didn't know how to do that, and they had the expertise to do that. So now all of the rest of the hospitals in Maine Health, which were part of the Maine Health system, we now have the expertise and the tools to take care of the patients, and that's a good thing because our flagship hospitals and our larger hospitals, Maine Medical Center, Pin Bay, Southern Maine, they're completely full right now, and not just with COVID patients, but patients in general. And so we're not even able to transfer our patients to the higher level of care. For example, in the last week, we had an individual in our ER intubated for a significant amount of time because there was no place to send the patient. So they sat in our ER until we were able to find patient placement. So you know, we're working through it, and I think that we're all doing a wonderful job, and we have great outcomes with the patients. We know how to treat it. We have monoclonal antibodies that we're doing up here, and so we're doing 5 or 6 of those a day, so that helps out quite a bit.
Now, is that an infusion?
That's an infusion.
So that somebody gets hooked up to an IV and they put that in, and that helps combat the disease or keep it from progressing to a very bad place.
Correct. Yeah, it keeps them, from progressing further and keeps the disease kind of at bay, if you will. So we're doing that, and that's helping out quite a bit. And in fact, just today we received our first National Guard individual that's helping us out with that process. If you recall earlier on there last week, the governor activated the Guard to help us out in that respect, and so it was nice to have that person on the site. Yeah. So, but overall, I think that the surge is concerning, and we think that in the next few weeks it could get worse, and so we're taking a look at our plans that we started off early on in the pandemic, where we were looking at shutting down practices and different things like that to get our physicians and our staff into the hospital to take care of a lot of patients. Hopefully we don't have to go that direction, but I think the indicators show that it's a very real possibility. So, but I think there's a couple other things happening too. Is the ambulance services have been very, very busy with COVID patients also, and regular patients. Our ERs are backed up. We have a 10-room ER, and we always have 19, 20, 25 patients in there trying to take care of them. Our hospitals are full with patients, and so really we're just chock full right now with the COVID surge, and in addition to the really sick patients that we experienced early on and when they delayed care.
And is your ICU full?
Yes, our ICU is full. We have a 4-bed ICU, and right now we're sitting full with mostly COVID patients. So.
And most of these COVID patients have not had their vaccination.
That is correct. So we do track that, and so I don't have the exact percentages, but it's usually about 75 to 85% of all patients in the hospital are unvaccinated.
Wow.
And as you get into the ICU, that number goes up a little bit higher, because the vaccination does keep people, there's breakthrough with the vaccination, but it keeps people from getting sick and having to have that higher level of care. And
I was just going to ask that question. So if you have been vaccinated, it's just like the flu. You can get vaccinated for the flu and still have a reaction or contract the flu, but it's just not near as bad as it would have been if you had not had the shot.
Yeah.
So is that somewhat true?
Yeah, that's absolutely true and correct. And so and it especially it protects the patients with more chronic conditions, so such as hypertension and all of those things. So it's definitely the best tool that we have right now to make sure that we help the healthcare system and work for our vision of our communities are healthiest in America. It's the best tool we have.
So Omicron, has it hit Franklin County yet?
We don't have any documented cases of Omicron. Our lab through Nordex, which is our lab partner in Maine Health, they do genomic sequencing of the virus. And so we've seen it in some other parts of the state, I believe, but we've not seen any up here in Franklin County. But there's so much disease process going on right now that I'm sure it's amongst us, and it's moving rapidly in Europe, which is a bellwether for the United States. And so I think it's just a matter of time before we see that variant pop up in our testing, but I believe it's probably amongst us right now.
Have you seen any difference in the type of vaccine or on breakthrough, or is it just generic? Pretty much everybody has a potential for breakthrough. I mean, Pfizer, Moderna, Johnson & Johnson.
I've not seen any data indicating what's better here at the ground level. I know there's some discussion in the press and the media that some may be better than others, but I don't have any real sense of anybody that has one or the other. I know a lot of our staff at the hospital, a lot of our care team members have received Moderna here, and some people have gotten it, some people haven't in the same situation. So, and versus Pfizer, and so it's just hard for us to tell here at the ground level.
I had my Modernas. I've had 3 of them. Then I have 3 chips. I have one that was put in this arm, one that was put in this arm, and one I took orally. So they can find me if I get lost when I get old. It's not a problem. And I had my 3rd shot. I mean, my shoulders. It's just now loosening up after about a week. It was sore. That was the only other side effect I had from it when I had it, my 3rd shot in there.
Yeah.
But you talked about the ambulance service being backed up. So part of that is in fact COVID, but there's other parts to it that are being affected by it.
Right. Yeah. There's some of it's COVID. A lot of it's just general volume of people that have delayed care in the past, and so also. Some of it's just the lack of transportation that we have in our region too, and we have a huge, vast expanse in Franklin County and in our region that we serve, and so sometimes it's used as a transport service for individuals that can't otherwise get to the hospital. So one way we kind of try to solve for that problem is we have what's called a community paramedicine program. And so we have paramedics that are trained in kind of house calls, and so they'll triage a patient and determine if they can take care of the patient there in their home, with up to their licensing availability. And if they can, they'll do that and keep them at home, and it's better for the patient. It's better for us, especially right now in this time. And then we also have the ability, we can kick it up a notch, and so we have telehealth abilities.
I was just going to ask about telehealth.
So we have the ability for that paramedic, if it needs a higher level of care, we can kick it over to a telehealth visit and get a physician or a nurse practitioner on that telehealth visit and keep them home even more, or make the decision to transport. So we're putting things in place like that, innovative things to kind of help load level the ambulance service. A lot of it too is transfer of hospital patients from our hospitals into Maine Medical Center or some of our larger hospitals. We're trying to load level patients as much as possible and where they need to go, and so having such high volume is taking a lot of time also. But majority of our time is spent on the road and going and getting patients and bringing them to the hospital. And so the crew is just amazing. I can't. I mean, our hospital crew as a whole is amazing, but our ambulance crew is just amazing. Also, they do things that large urban hospital ambulance services do, such as making sure that the patients are looked at for sepsis, all of those things before they get to the hospital. They're checking for those things, and so that's saving a lot of lives in that respect.
Wow. And how's your staffing holding up? I mean, we knew that some nurses left and others people left because they didn't want to get the vaccine. Are we holding our own?
Yeah, we're holding our own. So we lost about 40 to 45 individuals due to the vaccine mandate and not wanting to get the vaccine. And so we anticipated that, and we were a little bit more proactive than a lot of other organizations. When we learned of the vaccine mandate coming down, we really started gearing up and started trying to understand who was willing to get it and who wasn't, and making sure we could put plans in place for the departments that we knew would be greatly affected by that. Part of the way of doing that is first taking a look at the staff that we have, and we know that they're going to be picking up extra shifts to help fill gaps, and so we want to make sure they're compensated well for that. And so we've had a lot of incentive compensation in there to help them with that. And then the next step is travel agencies, which is as nurses, travel nurses. And it's one of our concerns as a healthcare system in the United States. I think people don't understand is that we pay a high premium for travel nurses. And as you can imagine, the demand is very high right now. And so some of our travel agencies are charging $200 to $210 an hour for a travel nurse. So it's a very significant situation. And so another situation that we're facing right now is so the travel agencies will try to take our nurses and say we can go work for somebody down the road and stay home at night. And so they're moving nurses amongst us in the state of Maine. So that's something that's concerning to us too. But it's adding to the already short staff before the pandemic. Before the pandemic even started, we were all short staffed. Nurses were just hard to come by.
Well, and you've got a partial solution that's starting to come place. It was announced kind of last week with Beale College. So tell us a little bit about that.
Yeah, so we have a great relationship with Beale College. We have, if you recall, we had a primary care practice down in Wilton that's been sitting vacant for some time. We were trying to sell it. And Bill reached out to us and asked us, hey, we're interested in the facility, and so we all went and took a look at it. And so we formed a partnership where we renovated the facility into a classroom space for nurses. And then also a sim lab for nurses also. And so in that partnership, then we have a lot of staff that's interested in becoming nurses. And so we're helping them monetarily and financially to go and take those classes for nursing for that particular program. So I think we have a couple people already enrolled for that for the January start. And so really that's the way out of this staffing shortage. And we've been very successful in education and in getting new graduate nurses coming out, multiple different programs, but this is just one way where we're taking a look at it. But it's not just for nurses also. We recently started up our own CNA program. And so we're really focused on the education of them. We'll pay people to take that CNA class. We'll pay their wages as if they're working for us to get them through CNA school. Looking at doing it for MAs as well, and also paramedics. So we're really trying to put our resources in there, knowing that growing our own and educating the new ones coming on is going to be the way out of this. Because part of the problem also, a lot of the older nurses that was close to retirement, they retired a little earlier than we had hoped for. So that's part of the reason also.
So when is the official date for Beale to open up? Do you know?
January 1st is their first, their first course.
Shows up. Well, we'll have to come and do a show on that.
Yeah,
when
yes.
we get into giving them some time to operate, maybe March or something like that. Come over and do an actual show of the nursing school. I can be the patient they can practice on. Except as I start cutting, that's when I start to get worried.
We'll get the needles out.
So, the hospital's changed, but you have some bigger strategic plans that you're thinking about for the hospital to make it more accessible to the people that live here with different practices. We've seen some of the different docs come in. We've had your new orthopod, if I can say that. We've had the new psychiatrist come on. You've just hired a new OBGYN. We had the emergency room doc come on. So how are you building this into a grand plan of what Franklin Memorial is going to look like in, say, 5 to 10 years?
Yeah. So yeah, I think that the first step that we really took a look at is the recruitment of our physicians in our service lines too. What service lines that we have? We have some really good service lines. OB, orthopedics. This one we really didn't have, and so we really took a look at that one and got a great physician, as you know. But we looked at the service lines first and understood what we needed to put into place, and we had a great recruitment effort. I think we recruited about 25 physicians in the last 18 months.
Wow, that's great.
And so a lot of ER physicians, and one that you didn't mention also was we also recruited a new pediatrician that started a couple of months ago. So we'll get her on the show also.
Great.
But now as we're starting to grow, we're starting to see some extensive volume increase. Excuse me. Particularly in our ER, our inpatient side of things that I didn't anticipate when I came here. My focus was really outpatient. The overall hospitals has grown dramatically also. So we're actually outgrowing all of our space. I mentioned earlier we have 19 to 20 patients in our ER, and our ER is 10 rooms. And so we're taking a look at our overall footprint of the organization and trying to determine what do we need in the future. And we're looking at expanding the ER. Our OR capabilities, expanding that, and then also maternal child, and then the med surg area by adding an addition to the hospital. And so I'll come back with more on that in the future. But looking at what does that look like, and I think it's going to be very transformative for our region, particularly as we see in some of our other regional hospitals going down in trauma levels, and so we need to make sure that we're able to care for our patients here, and in the space aspect is one of them. But we're still looking at growing our services. Some other things that we're taking a look at is wound care, chronic pain management, urgent care, different things like that, and where it makes a lot of sense. And so this year, we're making a lot of progress towards that plan, and it's very exciting.
I'd be interested to see what happens with urgent care, because years ago I used to say when the emergency room is where people went that didn't have the primary care physician. To go to the emergency room, high cost, which sometimes you never recovered because the person didn't have insurance. Tried to encourage them to get a primary care physician. They didn't do it, but they still used the emergency room for whatever reason. And was always suggested urgent care, and always told it can't afford it. So I'd be anxious to see how you are able to work through that.
Right, and I use urgent care loosely too. We're taking a look at what does it make sense, because as you mentioned, it doesn't make a lot of money, and so but sometimes it's not about money. It's about access to care and total cost of care, and that's something that we want to make sure we keep our eyes on, because it doesn't do any good to increase the total cost of care, because all we have is ER services. So we're taking a look at, does it make sense to have same-day walk-in clinics, and we have space for that, or more non-urgent care, what we call fast track. So low, it costs less to go to those particular things if you have the sniffles or whatever. One of the things we also have in place from a programmatic perspective is we have a navigator in our ER. And if somebody comes in for a low-level visit or they don't have a primary care provider, that navigator's responsibility is to try to match them up with a primary care provider. What we're seeing is a lot of the younger generation really just don't want a primary care provider. They just want immediate access to care.
Take care of me and let me go.
Yeah. So I think the walk-in clinic, or however we go down that road, whatever we decide, I think it's going to be beneficial, and we're excited about that. And it's going to take the load level off of our ER. There's a lot of things happen in the ER too that I think a lot of people don't understand, is the mental health crisis, which is a crisis with the pandemic right now. So in particular, amongst our adolescent individuals, sometimes we can have 6 to 9 patients in our ER that are in mental health crisis, and sometimes up to 50 days in our ER, just because there's no place to put them in the state of Maine. Reimbursements levels are low, et cetera. So we need to make sure we're able to build a facility with these new pressures that we have. Our facility was built in 1975. Things have changed dramatically since 1975. I wasn't even born in 1975.
I was 25 years old.
So yeah,
You
we're
missed a lot of good years, but for some reason, I missed some of them too. I don't remember.
So yeah, but we're taking a look at that mental health crisis right now. Is just astronomical. Our new psychiatrist is actually pretty much saturated with patients already.
Really?
So we're
Wow.
looking at adding another psychiatrist. So
Wow, that's great. I know the emergency room, I would be remiss in not mentioning Dr. Gammon, because about 2 months ago, I had to go visit the emergency room because I was falling over to one side. Nobody could figure out why I wasn't falling to both sides. And went in, and Dr. Gammon was providing my care. He was great. Only problem for Dr. Gammon is because your new patient portal, when they'd send me for a test, I had the results before he did. So when he came in the room, I said, hey, my blood sugar's a little bit high. I think that's because I had Cheerios for breakfast this morning, And on this test, it came back, oh, it's normal, so we got to keep going. But he was great. He really communicated with me. He really took his time to explain what I was going to be tested for and what would look for results. And finally, I looked at him and said, I think I'm okay. I can go home. He said, you sure? I said, yeah, I'm ready to go home. But he was great. I just want to pass that on to you. He was a young person in there and actually has relatives in Mount Vernon. But he hadn't met him yet, and I knew his uncle, so our cousin, whatever it was, and so encouraged him to go meet with him. But they were great people.
Good. Yeah, we spent a lot of time hiring 7 or 8 new ER physicians, and so we're really successful on that. One thing I just want to point out also, I know you had a great experience in the ER, and that's something we're always making sure everybody has, but I know the community's been waiting a lot longer out in our waiting rooms just because the volume we've experienced is stuff we've never seen before. So just asking for a little grace from the community that we understand that, and we'll work as hard as we can.
The only suggestion I'd always have is that if you know somebody's come in, send somebody out periodically to say, hey, we know you're here, we haven't forgotten about you. That's always the fear. You get in there and you're waiting, and not you, just you. It's any emergency room I've been into. You're waiting and you say, did they forget me? Did they forget me? It's just to have somebody communicate with them. I think that would do the world of difference. But Franklin Memorial is one of the reasons why we moved here. When I was transferred to the Mill and J, and I looked at the area, I said, I want to have a hospital that's close by, because I had 2 little kids growing up, and knowing what I used the hospital for when I was their age, I needed one close by. And I wanted a community that had special places. So we have Titcomb, we have the golf course, we have the hospital, we got a great school system. Some pretty cool people here too.
Yeah, the people are just amazing. It's a slice of heaven here.
Yeah, it is. It really is. By the way, I like your bow tie.
Thank you.
And you even got a little, what do they call those things?
It's a pocket.
Pocket handkerchief, or and it matches.
Yeah.
And everybody, so he knows, he's even got Santa socks on. Look at that. Let's get a little close up on these socks of the president here. Can you get those? Well, you can see him up there on there. He's got a picture of his socks. He came prepared for the holidays. So you here for the holidays yourself?
Here for the holidays. So I got family coming, and I think I've overspent for them, but that's what it's all about, right?
That's exactly right. The way I look at it is, when I go, they're going to have it all, so I might as well give it to them now and look for the smiles on their face, and that's more important to me than anything in the world.
Absolutely.
So if you had one gift you wanted the hospital to get, what would you get?
Oh,
I got you that one.
That's a loaded question. So I would have to say right now, the gift that I would ask for right now is everybody is vaccinated in the whole entire county. I think that would be the best gift we could ever have. Our staff is just working extremely hard. And I go to the floors and in the clinics, and I'm just amazed at the resiliency they have right now. And so it just breaks my heart that they're working so hard. And so if everybody got vaccinated, that'd be the gift I'd ask.
That's a good request. 2 questions out of that. Can they get vaccinated at the hospital? Do you have a program, or do they go to the drugstores and so forth? And if so, do they make an appointment to get one?
Right. So you can go to your primary care provider and get your vaccination.
Okay.
And then also the drugstores also. So.
And testing. If I wanted to be tested, can I come to the hospital to get done? Is it still outside like it was before?
Yeah. The COVID testing clinic is outside there. You just give your primary care doc or your doc a holler and let them know that you've got every reason you need to be testing. They get that set up for you, and then you call the hospital, your primary care doc, and then they can get that set up for you.
And any symptoms that you can describe that if somebody thinks, well, I better go get checked, what might they be?
So there's your normal cold stuff you would experience, headaches, sniffles, all of those things. If you've been exposed to individuals, I would definitely go get tested.
Yeah, so that's one thing I don't know. I mean, we have the store, and I don't know who comes in and who comes out, but I feel good. So, I've had my 3 shots, so I'm figure out I'm good for a while. Plus, I have O negative blood, and there's somewhere I read in a report that that's not as susceptible as the others.
I'm the same way, O neg here. So.
Oh, see, so I'll take care of you, you take care of me.
No, that works.
We're good because we're the only two who can take care of each other.
Absolutely.
Trampas, I want to thank you for coming on the show. And it's great to have somebody like yourself that wants to be part of the community that's the president of Franklin Memorial Hospital. In the past, I sometimes didn't sense that, and we've talked about that. But you were a judge at Chester Greenwood Parade, and been known to stop in at some of the local watering holes to get a glass of water, and it's been just a real pleasure to be that. By the way, you owe the beer next time we go on.
I do. Yeah, I'll get you.
All right. Thank you so much for coming on the show. I appreciate this. So this is Tom Saviello for Talkin Maine. If you got any questions for the president, give a call to the general number at the hospital and ask for him. I'm sure he'd be glad to answer your questions. We'll see you next time on Talkin Maine.